Welcome to Times Conversations. I am Paloma and today's topic is diabetes with the expert team from Parvathy Hospitals. What are the different facets and how do you all work as a team here at Parvathy Hospitals? If you all could shine some light on that and each doctor's role.
At Parvathy Hospital, we have designated and we have designed a proper workflow of once when the patient enters into the hospital per se, once the registration and every process is done, the first person that the patient is going to meet is a dietitian and a counselor. Because the primary aim of us is to not to take the patient for a surgery or for a secondary complication. The first process that we are going to try here is preserving our patient, preserving all the end parts of our patient.
One more thing which we see usually will be whether the patient's sugars are controlled or not and what are his old medications. And if we feel the patient is on improper treatment or treatment is not proper, his sugars are not getting controlled, we should try to change the medicines. And if the patient is having any ulcers or any other complications of that, we might also suggest insulin for a time being so that if any wound is there, any ulcers there, that also starts healing.
So when the glycemic control is achieved, so the next is to reconstruct the vascularity of the limb, because this is the foundation on which every soft tissue reconstruction can be based.
So diabetes and infection, it forms a vicious cycle. So once there is uncontrolled diabetes, the infection is going to rise. And once the infection rises, the sugars are going to get uncontrolled. So once these two factors are taken care of, my role as a vascular surgeon is to palpate the pulses.
During this staged procedures, one of the stage is putting some metals, implants, screws to lift the toes or to lift the foot so that the arch is not collapsing. The recent advances is super construct, to include normal joints in front and back or in the sides so that further recurrence is prevented.